Very nice. I can see people are joining. I will wait for 1 minute to see that some more people have joined. Good morning, good afternoon to everyone. I see that people are still joining. But since we only have 1 hour and the time is short, I would say I start with some technical instructions, and then we will go ahead with our webinar. So welcome to everybody who's already here. We can go on the next slide, Nitya. So some technical instructions. If you'd like to, it would be great if you could ensure that your name, organization, and country are visible. You can use the rename button for that purpose. By default, all participants are in mute mode. If you have any questions to the speakers, you can use the Q&A button. We have some time reserved for questions after the inputs. If you have any other questions or you need technical support, please let us know in the chat or contact my colleague Marie directly. You can see her in her name. It says also technical support. Also, for your information, the session will be recorded. Go to the next slide. Thank you, Nitya. The presentations will be conducted in English and Bahasa Indonesia. We are providing translations for these 2 languages and for Kannada. Please choose the language that you feel most comfortable with by pressing the interpretation button below, the one that looks like a little globe. Next slide, please. For Indonesian, please click Indonesian, and for Bahasa Indonesia, and for Kannada, please click on Kannada. If you want to hear only the voice of the translator, please click on mute original audio. And now I would like to welcome you all again to our session on learnings and obstacles, how we engage for a gender lens in occupational safety and health, in short, OSH. I am Lisa Karl, a project manager for the German women's rights organization FEMNET, which is based in Bonn and has been working for more than 15 years on improving the implementation of workers' rights in the garment and footwear sector. My role today is to guide you through the next hour. The workforce in the garment and footwear industry in India and Indonesia is mostly made up of female workers. Yet gender-specific data is often lacking, or if it exists, there's a lack of knowledge of how to analyze it or how to implement necessary changes. What is very obvious is the need for gender-responsive occupational safety and health systems. Today, we would like to discuss how this knowledge can be translated from theory into practice. And first, I would like to provide you with a little bit of background on the session and its organizers. For over 2 years now, FEMNET has been working with the NGOs Cividep India, Trade Union Rights Center Indonesia, and the SÜDWIND-Institut from Germany in a multi-actors partnership on gender and health. It is these 4 organizations that have organized the session today. The multi-actors partnership is funded by the German Ministry for Economic Cooperation and Development. We have collected and analyzed data, set up national and transnational dialogue structures, implemented diverse activities to raise awareness, inform, and train people on the topic. Currently, we're in the process of developing constructive and practical guidelines to include a gender-responsive perspective in OSH systems, which will also be implemented in pilot factories. The goal of our initiative is to bring together important stakeholders of the industry, such as trade unionists, local NGOs, other multi-stakeholder initiatives, international brands, and factory management of shoe and garment factories, and to set up measures that will make the systematic discrimination of women regarding their health situation obsolete. For this session today, we have invited 6 speakers representing different stakeholder groups. A worker representative from Indonesia, a corporate social responsibility manager from a shoe factory in Indonesia, a factory manager from a garment factory in India, and 3 representatives from our project team will share some hand-on approaches on how to implement specific measures that contribute to a more gender-specific OSH system. And now I would like to give the floor to our first speaker, Fitri Masuri, who has been working at an Indonesian shoe factory with export orientation since 2007. She joined the Indonesian labor union SPN in the same year and now holds the office as Vice General Chairperson on plant level. In addition, she also serves as the Deputy Chairperson of the Women and Children Protection Division at the district level. Despite her work in the factory and the labor union, she has managed to complete her studies in law. Fitri Masuri will give us an insight into the agreements that she, together with her labor union, has reached with the factory management. The floor is yours, Fitri.
Ya, terima kasih. Selamat pagi, selamat siang, selamat sore semuanya pada para hadirin yang terhormat. Saya Fitri Maisuri, saya Wakil Ketua Umum PSPSPN
Deputy Chef of PSPS
di Provinsi Banten, Indonesia. Hari ini saya akan membahas tentang negosiasi yang pernah kami lakukan untuk akses penyediaan pembalut gratis dan cuti haid. Terima kasih semuanya yang telah bergabung. Selanjutnya, slide selanjutnya. Pertama, saya akan berbagi kisah sukses SPN dalam negosiasi untuk pemberian akses pengadaan pembalut gratis kepada para pekerja.
So, ಮೊದಲಿಗೆ ನಮಗೆ ನಾವು
prompted SPN to act. So through the research conducted by TURC, it was revealed that female workers had difficulties in accessing sanitary pads during menstruation. And female workers even took the initiative to buy and sell sanitary pads in the production building because the access was really difficult. So this finding became the background for SPN in the Nico Mas Gemilang company to have a dialogue with the company and demand the company to provide free sanitary pads for female workers. However, in the process, there were several issues or reasons that the company took into consideration. So first, the consideration regarding the cost for the company. Second, there are many brands of sanitary pads available on the market. And third, the concern regarding the incompatibility between the certain brands of sanitary pads and individual preferences of each worker. SPN realizes that this issue is not only about comfort, but also about human rights, about gender equality, workers' health, and welfare rights. So therefore, here are the arguments from SPN. First, it is important to be aware of the uncertainty of the menstrual cycle. For example, imagine a female worker who suddenly starts having a period and doesn't have any sanitary napkins or sanitary pads. And without adequate access, she will feel uncomfortable and have difficulty concentrating at work. Second, the importance of emphasizing the need for companies to address these issues. This is not just a matter of comfort, but also about workers' well-being and workers' especially female workers' reproductive health. So how is it being implemented? So in the end, the company allocated free sanitary pads to female workers without any quantity limits. These sanitary pads are placed in an office space near the production building to make it easier for female workers to access sanitary pads. So besides that, the provision of free menstrual pads also has been regulated in the CBA between the trade union and the company. So now we already have these free sanitary pads. It's already procured. So in this slide, I will share about the success story of SPN in shifting the menstrual break term to menstrual leave. And I know this change or shift of terms might be kind of like overlooked. Why should we change it in the first place? First, we need to recognize the differences between rest or break with the leave. You know, break can be done anytime, anywhere, but leave is very specific. It can be at home, which is much safer and much more comfortable for female workers. So it can recover it. The situation can make the female workers recover quicker. At first, the company was not really in favor of this change of terms because they are afraid that the female workers might ask for the compensation if they didn't take the leave, right? But then we convinced them that it doesn't mean that they will be compensated if they do not take the menstrual leave. So we guarantee the company that
menstrual rest
workers that the menstrual leave cannot be compensated with money. Second, the company should follow, the biological nature of women, that they have to have this menstrual cycle. And third, we try to convince them that the first and second day of menstrual leave could be much more productive for female workers because they could recover better and they could be more productive later. So how is it being implemented that? So we have arranged the process of the menstrual leave that is based on the agreement between the company and the trade unions. So this is like a joint commitment between the trade union and the company so that we can provide a better working environment for the workers. Next slide. So in this slide, I will discuss about why then the company followed our suggestions. First, because like it both enhanced the company's image concerning worker audits conducted by auditors and grades. Second, that those two initiative could really enhance the brands, right? The brand or the image of the company. And they could also gain like the positive response from the auditors and brands because like they improve the condition of female workers. Second, the company could also showcase their commitments to promote the female workers' right. And next, why SPN? Why is SPN actively participating in the gender-responsive OSH coalition with the MAP Health initiative from TURC? First, SPN recognized the importance of OSH being with gender-responsive OSH with the large number of female members in our organization. Second, SPN also seeks to collect suggestions and input from external sources to evaluate the current OSH implementation at the factory. So whether the standards are adequate and address the specific needs of women workers or not. Third, we also seek to identify areas where companies' efforts are insufficient to meet the needs of female workers. For example, the availability of counselors, increasing awareness of mental health, and so forth. So these examples could equip the union, committees, and officials with the knowledge and skills necessary to address the concerns of women workers. And by collaborating with MAP Health in this coalition, SPN expects that this could create a safer, more inclusive, and supportive work environment for all workers. Thank you for your attention. So I think that's all that I could share with you. Thank you.
Thank you so much, Fitri. I would now like to hand over to Kaveri MT, Associate of the Health and Safety Initiatives at the labor rights organization Cividep India. She has been working for Cividep since 2019 and has been working with the Multi-Actors Partnership since the beginning. Kaveri has a master's degree in food science and nutrition, and she believes that women empowerment greatly benefits society. This has propelled her to focus on labor rights, gender-related issues, nutrition, and health gaps faced by women workers in the informal sector. Kaveri will now give us some insight on one of the activities of our Multi-Actors Partnership aimed at empowering women in their health decisions. The floor is yours, Kaveri. Go ahead.
Thank you, Lisa. Good morning and good afternoon, everyone. I'm Kaveri from Cividep India. Cividep India is a civil society organization based in Bangalore and with field offices in other locations in South India. Our work aims to safeguard the rights of marginalized communities, especially workers employed in global supply chains like the garment, leather, electronics industries, and coffee and tea plantation sectors. We do this by critically analyzing business and human rights due diligence by global corporations in their India supply chains. It is this focus on business and human rights that made us study gender and health in the garment industry in Bangalore, which primarily caters to global corporations. Moving on. As part of the MAP project, Cividep conducted a study among women garment workers to document the various health issues they experienced. The results of this survey highlighted 4 key areas of concern to address immediately: musculoskeletal health, reproductive health, nutritional issues, and mental health. As a follow-up action to improve the health of garment workers, we organized a training of trainers workshop. Next. So what exactly is a training of a trainer? It is a framework for training people from a particular community to disseminate information and raise awareness amongst the community members they are associated with. It is a powerful tool in community development and health promotion. It empowers local leaders with the skills and knowledge to bring positive change to their communities. Through training of trainers, individuals become equipped to address specific needs and challenges effectively. This approach fosters peer support, sustainability, and empowerment, making it a key strategy for improving health and well-being in communities. In the context of this project, we identified 20 trainers from the grassroots organizations working for the welfare of garment workers, as well as worker leaders from the garment workers community in and around Bangalore, India. This training was to raise awareness amongst workers on various health issues identified in our previous study and to foster health-seeking behavior in them. This approach was chosen as it could cater to wider audience and was a sustainable option as well. Our workshop aimed to deepen trainers' understanding of health and its social determinants with a specific focus on reproductive health, nutrition, and musculoskeletal well-being. The objectives included identifying the symptoms related to these health issues, fostering basic self-care skills, facilitating discussions on barriers and solutions to self-care, health-seeking behavior, and impact of work on the health of workers. As mentioned earlier, the goal of this training, or the TOT, was to empower trainers with essential skills to effectively convey and disseminate health information among women garment workers and to promote health-seeking behavior. Let's now look at how these training sessions have impacted the grassroots and the workers. Now, for the grassroots, the health training of the trainer has equipped the grassroots organization with knowledge, skills, and resources needed to address health-related issues within their community. Through this training, they could expand their capacity to deliver health education, promote preventive measures, and provide essential health services to the workers. The trained trainers can effectively disseminate health information to a larger audience now on a regular basis, thereby amplifying the organization's effort to improve health outcomes within the community. The training has created an opportunity for them, includes government agencies, non-profit organizations, and other healthcare providers, thereby advocating for policy changes and social reforms to address the systemic health issues affecting their communities. It has also nurtured leadership skills among trainers, empowering them to take on leadership roles within their organizations and the community. The trained trainers have emerged as local champions for health promotion, advocating for positive change, and inspiring others to get involved in health initiatives within the community. Next, how has this impacted the workers? Workers are now aware of workplace hazards, and they adhere to the safety protocols and advocate for better OSH facilities in the factories, thereby reducing workplace accidents. The trainings on topics such as reproductive health, nutrition, and musculoskeletal health has raised awareness amongst garment workers about the common health issues and their preventive measures. Workers have learned about the importance of maintaining a balanced diet, they practice stress management techniques, and they also seek timely medical care, which has empowered them to make informed decisions about their health and well-being, both on and off the job. These workers are aware of the available healthcare resources in the community and how to access these affordable healthcare services, thereby improving their access to timely medical treatment and preventive care. By equipping these garment workers with the knowledge and skills to maintain their health, the training of the trainers has actually led to a healthier workforce. So in conclusion, can we have the next slide, please? Improving the health status of a specific community, in this case, like the women garment factory workers in Karnataka, this includes efforts to empower these women to see health as their fundamental human right and to be able to make efforts towards enabling change in health behavior and choices for themselves, their families, and their peers. By acknowledging health as a fundamental human right and prioritizing their health, the training of the trainers session not only reduces the vulnerability of the workforce, but also fosters a healthier work environment. By investing in such training, we not only equip workers with essential knowledge and skills, but also empower them to advocate for their health and well-being, even within their workplace. This, in turn, leads to reduced attrition rates, lower absenteeism, and ultimately a healthier workforce. Furthermore, embracing health TOT enhances compliance and regulations within the industry standards, positioning factories to gain a competitive advantage in the market. Therefore, let us all continue to prioritize health and empower our workers. To know more about our other activities, do get in touch with us. Over to you, Lisa. Thank you.
Sorry, Kaveri. Thank you very much for your presentation. The next presentation will give you some more information on the systematic approach that we chose to tackle the issue of health discrimination at the workplace, our gender-sensitive guidelines. Didit Saleh, who is actively involved with TURC as Deputy Program Director, has also been part of the MAP team since the start of the project. His work puts a focus on researching employment and social protection matters, and his interests include labor studies, social protection, and political economy. The floor is yours, Didit.
Yeah, thank you, Lisa. Thank you for audience. I would like to explain our draft transformative guideline for gender responsive arts in the garment and footwear industry in Indonesia and India. This is like, we would like to emphasize our draft guideline beyond the compliance and emphasizing empowering the workers. Next slide. Yeah, the guideline have been formulating based on our research finding and conducting in India and Indonesia. In additional discussion were held with various stakeholders such as trade unions, non-government organization in both countries, multi-stakeholder initiative, to gather input and feedback on the draft guidelines. So we got a lot of feedback from the international that conducting by the SÜDWIND and FEMNET, from Indonesian, from the Cividep. Next. Next, okay. Who will be target audience and benefit, potential benefit for gender responsive arts? The target audience for the guideline comprises implementers such as brands, factories, as well as other stakeholders like trade union, worker, multi-stakeholder initiative, policymaker, in example, a government and other as frame of reference. So what is the potential benefit? The potential benefit of implementing this guideline, including reduced medical costs associated with work accidents and work-related disease, as well as decreasing expense related to hiring, retirement, and training new workers. I will say that this is a potential benefit. And next slide. What we cover in our draft of guideline. There is 4 sections. The first section provides an overview of the importance of the guideline, identify the user of the guideline, and the outline or legal framework on the national and international levels. And the second section, this part elaborate on creating a business environment that is more responsive to gender, including the challenge faced by women workers in the shoe and garment business model in both countries. The third section, we would like this part highlight 5 aspects based on our research finding, observation, and the input from various stakeholders. What is the 4 aspects? The 4 aspects in both countries, for example, musculoskeletal, as our friends Kaveri mentioned before, psychosocial, reproductive health, and gender-based violence. And one aspect, a specific based on Indian team research finding related with the nutrition aspect. The last section, we would like to, conclude the guidelines. Next. There are 4 crucial aspects for the successful integration of the OS gender management system at the factory level. One of the fundamental crucial aspect, commitment policy. The commitment policy from the brand or the supplier, factory management, a government, and trade union. But one of we have a commitment between a trade union, for example, and the factory to implement it, the guideline will be, will be implemented. And the second one, if we have a commitment, we can planning what kind of activity we do and do early assessment, right? A risk assessment first and creating something after we got information based on our risk assessment activities. And the third one is implementation, meaning that prevention and handling. If we have a lot of data, about the, you know, that the problem in the factory level, we can creating some activities, prevention activities and handling activities. And the last one is monitoring, evaluation and learning. Let me give you example. This is like next slide. Next slide. Let me give you example. This is like WOS responsive gender management system flow, or GMS, example on mental health issue. If we have a commitment between a trade union and a factory level, so what should we do in the first? The first one, we should, you know, that the first step is to conduct risk assessment or risk identification to understand the challenge faced by the worker, specifically by the woman worker in the context of, for instance, analyzing target production and addressing previous mental health complaints. And next, we create a preventive activities and procedure for handling OSH issue. For example, providing training to management, supervisor, and worker, and maximizing the role of the OSH committee. But the important thing on the prevention and handlings, not only training as a prevention action, but also make sure the role of, or the role of the suppliers and to implement it. The last one, through this process, is essential to conduct monitoring, evaluation, and learning mechanism for continuous improvement. And the last slide, I would like to summarize the effectiveness of gender responsive of guidelines relies on active participation on ongoing enhancement. This approach stresses continual involvement from stakeholders, creating a dynamic system that adeptly addresses gender-specific consideration in occupational health and safety. I will stop here. Thanks for the entire audience. I will hand it back to the moderator. Thank you.
Thank you very much, Didit. Now that we have heard inputs by a workers' representative and 2 representatives of NGOs fighting for labor rights in the industry, I think it is time to take a glance at what the factory management can do to actively improve the health situation of their workers and why it is interesting for them to engage with local NGOs and trade unionists. First, I would like to give the floor to Yuni Susanti, who is a senior manager of corporate responsibility in one of the shoe factories in Indonesia. She completed her studies majoring public health. She has 15 years of experience in the health, safety, environment, and labor practice field. Yuni, the floor is yours.
Okay, thank you so much. Thank you, Lisa. Good morning and good afternoon, everyone. First of all, I would like to thank you so much for giving us the opportunity to share about the implementation of the responsive gender and occupational health and safety program in our company. Next. Yeah, this is our company profile, PWI2, located in Serang, Banten, Indonesia, and established since 2011. We are shoes manufacturing that produce international brand with 800K capacity per month, and currently we have 8,611 workers that consist of 90% female and 10% male. Next. Yeah, we have 10 labor union here, and we have collective bargaining agreement that included with the women concerned and refer to the local law. And we also have women participation in our organization, and the composition for the leader quite equal, with 45% for women and then 55% for men. Next. Yeah, we also have workplace counseling program with dedicated counselor from the psychology, and then we have worker mobile application to handle and raise up if any issue related with labor and occupational health safety case. So all workers can easily access the channel and give the response or feedback from the management anytime they need with the timely manner. Next. Yeah. As considered that 90% our workers are women, so we have several programs to ensure the health status for the women, such as an antenatal care for the pregnant worker, and then determine the safe working area for the pregnant worker, and then provide the lactating room for the breastfeeding mom, and the nutrition increasing program, and then regular health check, including pap smear test for the woman worker. Next. We also have comprehensive training program, especially for the women, such as PACE, Personal Advancement and Career Enhancement Training Program, since 2022, with the duration of the training is 8 months training, and then we already done for the 2 batch, almost 1,000 female workers trained, and continue for this year with RISE, Reimagining Industry to Support Equality. And we engage with our buyer and then professional training consultant for this training. Both of these training focus for the communication skill, time and stress management, and then problem solving and decision making, also about gender equality. Next. Yeah, and then for the collaborative project with TURC, Cividep, SÜDWIND, and FEMNET, we start this project on early of 2023, January. We support the gender responsive and occupational health safety program, and we got a lot of positive input and impact related with this project. But we also have some challenge to implement this project, such as lack of the awareness and understanding from the employee about gender responsive and occupational health safety standard. Due to the mixed educational background from the worker, we have elementary school until bachelor degree for the worker, and then the implementation consistency in a daily basis for the project, and then we have social norm and cultural practice for the gender responsive. Due to in Indonesia, we have a lot of social norm about gender, so sometimes we found some challenge to implement this project. I think that's all for me. Thank you so much for this opportunity. Back to Lisa. Thank you.
Thank you very much, Yuni. Now we get to listen to the perspective of Hasim Ali, who's the head of operations, human resources, international relations and compliance at Metro Fabrics, a garment factory in Karur, India. He has more than 15 years of experience in different industries such as the textile, automobile, and IT sectors. He holds a master's degree in social work, is a certified IT networking associate, and psychologist. His interest is empowering working women and their families in terms of education, culture, and wealth. Hasim, the floor is yours.
Yes, thank you, Lisa. Thanks for the opportunity given for me in this panel. Yeah, I'm Azim from Metro Fabrics, and I am taking care of operations and HR and IR activities here. Basically, we work for UK, US based brands. Now we are mainly focusing on our workers' health and safety conditions, because in our factory, wherever in India, if you take any garments or any textile industries, more than 50% employees are women. So particularly we have to focus them very importantly. So we considered them to be very proactive, and they have to be, the health condition should be good for working. Next slide. Yeah. For that, we have to be physically, emotionally, and mentally, the woman should be very powerful, because there may be discrimination, injury, stress, everything will be there. So our company policy is to overcome all those hurdles from work-related issues. Next slide. Next slide. Yeah, this is our health and safety policy. We proactively, we believe that there should not be any accidents inside the factory, and the health condition of the woman outside the factory is also most important. Next slide. Yeah. Now, let me come to the practical point. Actually, the women workers are coming to our company from around 100 kilometers or 70 kilometers from here. So they come by bus, by their own or by the company provided bus. So mostly women are married. So they have to take care of their children and they have to take care of their family. So for reaching the factory by 9 o'clock, they have to start from their home house by 7 o'clock. So it is 7 a.m. So taking morning breakfast is the main issue for them because they won't take maximum, they won't take the breakfast. So the main problem here, due to skipping the breakfast, they go into anemic, blood pressure, blood sugar, all those things. So what we thought is we implemented and we invested in a program called Invest for Wellness. In that we have treated 3 different kind of problems to be faced, like anemia, blood pressure, and blood sugar. So what we did is we will be conducting a program. We will be conducting a checkup by every 3 months, like blood checkup and blood sugar and blood pressure. Once we conduct the checkup, we will give them the inputs. What are the activities they have to take care and what are the activities they have to immediately change to overcome this kind of health issues. Next slide. Yeah, this is the program we started on 18th July 2022 and we ended it on 17th July 2023. In this program, we have concentrated on blood pressure, blood sugar, and anemia. Now, in next session, we are going to progress on breast cancer related to issue like that. Next slide. Yeah. By implementing this, we have a good successful story of.
So, now we program madodrinda namge vandu
just 6.7, and after 3 months of intake like folic iron folic tablets and change in their diet, now her hemoglobin level came up to 9.7. This is the success story of her. We believe this success story should be go to every one of the employees, even they are women or men. It is most important for us. It gives us more productive also, because if the woman is very sick, she can't work properly. So it is like we both mutually we will get benefits, worker and the company. Next slide. We have an opportunity of getting the partnership with Cividep. Last month, they have a good study has been conducted over here for occupational health and safety. The study was very good, and our employees were very nice, and they told a lot of positive replies. And we are still we are getting inputs from Cividep. If they give more inputs, it will be very helpful for us to move forward. Next one. Yeah, thank you for the opportunity, and this created us a productivity increase and decrease in absenteeism, and both the way, like I already said, it benefits both the worker and the management. Thank you for the opportunity given for me from FEMNET and Cividep. Thank you, Lisa. Thank you for it.
Thank you very much, Hasim. And last but not least, our colleague Jiska Gujovcik from the SÜDWIND-Institut will give us a quick overview on how we plan and organize our dialogue structures across borders to learn and benefit from each other. Jiska Gujovcik is sociologist and researcher at the SÜDWIND-Institut in Bonn in Germany. She researches social and economic injustices in the production of footwear, apparel, and leather, and has developed a particular interest in the meso and micro level strategies of labor exploitation in the recent years. Jiska, the floor is yours.
Yes. Hello, everyone, and thank you, Lisa, for the introduction. As the last speaker in this round, I will talk about the organization of international dialogue, which is among our core strategies in our project for better OSH in the garment and footwear industry. Next slide. Before I do so, let me shortly introduce my home base, which is the SÜDWIND-Institut. SÜDWIND is located in Bonn in Germany, and since more than 30 years, it operates as a research and also as a lobby organization striving to contribute to more justice and economic relations across the globe. Next slide. In our project that brings us together today, our common goal is to improve the health of workers in the garment and footwear industry, and especially women and other marginalized groups, which make up the large majority of the workforce. But of course, we also know that so far they often cannot decide to protect their health, sometimes even if they had the trainings that we just discussed. And the surroundings make it very difficult for them to influence the situation positively. Women and other marginalized groups are still highly underrepresented in decision-making bodies, in most factories, in parliaments and courts worldwide, and unfortunately, of course, also in many trade unions as well. But at the same time, we have learned in our 2 years of work in the project, we are surely not the only ones who want to see more gender justice in the industry, including the field of occupational health and safety. And as we have also seen in this panel so far, different stakeholder groups already started to implement activities. However, we also find that for many drivers of the risky environment for the workers' health, for example, high production targets, there's no easy fix. That is why we think to find ways forward, we also need to develop ideas together. We need to learn from each other and speak to each other. And I will now show how we organize this in the project. Next slide. Colleagues from Cividep India and the Trade Union Rights Center in Indonesia have set up core groups that bring together unionists and grassroots, experts on the national level, regional MSI representatives, and factory management. And in those core groups, they're discussing and advising the project team. And as you have learned before, they work a lot on the guidelines currently, which Didit Salih just talked about. In addition, in both countries, there's a lot of bilateral exchanges, of course, taking place, for example, with policymakers and other local stakeholders. Then we have dialogue that is more transnational, involving brands, retailers, and other actors in the value chain, experts, international organizations, civil society actors from different countries. And most of this dialogue is bilateral, but we have also created some other rounds and groups, especially one online working group on the specific topic of data on gender and OSH. And I will say more about this in a second. And then we have created an online format, which we call International Dialogue Forum, which brings everyone together. Next slide, please. This International Dialogue Forum, in the past, we have always had a public and a closed part, whereas in this closed part, you can attend by invitation only. And in this closed part, we brought together core group members from both countries and very committed transnational stakeholders, as well as the project team. So far, this has taken place twice in the last year. And what was always important for us in those meetings was to give space to the female workers' voices. That we always had translation, as we're also having in this meeting today. And we followed respectful and open exchange in those rounds. Content-wise, in the first session, we've been working on a common vision. And in the second one, we discussed our first draft of the guidelines. And next slide, yes. This, what you see here, is the result of the first session, where we looked at our vision, and this is the vision picture. Next slide. And then I already mentioned that on the transnational level, we created a working group. And this is focusing on gender data. And that decision was the result of our first conversations with stakeholders at the beginning of the project. We were asking retailers, brands, what is holding you back to get active? And where do you see need for improvements? And data and anything around data was a very prominent answer there. So we have been the initiators, the organizers of this group, but we really only created the opportunity that then different attendees used to think out loud, to share their cases and problems, and input really came from participants from the beginning. We convened with Chatham House rules, and we've seen in a short evaluation after a couple of months that even in a very short time period, there was a high level of trust in the group. And we met monthly for 2 hours, and it was always 10 to 20 people participating. Currently, we're seeing that the groups separate depending on different levels of commitment and different interests. One working group now strives to write something more concrete, to create something more tangible together, and we as organizers have less responsibilities. And then there's still a learning circle where the focus is on peer-to-peer learning, and it's less time-consuming and less binding. And the project team, we as a project team still organize this every second month. And last but not least, last slide. As we are moving towards the end of this first phase of the whole project, we are of course reflecting what should we do next, and are there additional stakeholders that we would like to engage more, and there certainly are, such as auditing companies and auditors and intermediary trade firms that so far we haven't involved much. And of course, we plan further capacity building for stakeholders, for example, how to get engaged in international dialogues for trade union members. And the most important step for the upcoming month is, of course, the discussion and the promotion of the guidelines. And my last words, if you have now listened to all of this and thought, why have they not contacted me yet? Please make the first move and send us a message, and now we'll start the dialogue ASAP. Thank you.
Thank you, Jiska. We know that that was a lot of input in the last 50 minutes and from different actors, and we would be very happy to answer some of your questions. We'll try. As you can see, time is it's very quite late already, so we can't promise that all your questions will be answered, but you're always very welcome to contact us again after the session, and we will give our best to answer to your question or to connect you with a specific person. My colleague Kiki from TURC will be your voice today. Kiki, what is the first question to our speakers?
Okay, thank you, Lisa. Because we have a limited time, so I choose 3 questions to Didit, Fitri, and Uni. But firstly, to Didit, we have a question from Birte Rodenberg. She asked about the concerning measures for better health aspect with regard to SRHR and menstrual problems. What can be done for home-based workers? How to make sure that they are also can benefit from example time of the first 2 days of menstrual health problems, free access to sanitary pads and etc. Maybe Didit can answer this question. Thank you.
Thank you, Victor. The first one, we have do a judicial review, conduct judicial review to constitutional code to recognize the home-based worker as workers. In Indonesia, lack of knowledge from the governments, not recognized by the government, home-based worker is not worker. So we should recognize the first one, home-based worker is workers. It's the first one. The second step, we TURC propose to home-based worker get from the government like social assistance. For example, health insurance from the government, but it's not, change the problem in the field. What's the home-based workers feeling in the field? This is our answer. Maybe the first one we should recognize, but the government rejected our, our judicial review to constitutional code. This is the question. I answered the questions from the Barbara, the last ones maybe. Last one from the Barbara. Why does this draft only focus on nutrition specific to India? The first, research in Indonesia is not focused on examining whether nutrition is crucial aspect regulated. And the second one, based on our existing regulation, Indonesia have regulated nutrition if you work in the third shift. But our document is living document. If you have a data, is nutrition is important from Indonesia, I will collect it, the data, and I will make sure this aspect covered in our guideline. But until now, we don't have any data because we do not focus on nutrition in our research findings. Thank you. Thank you, Gigi.
Thank you. Yeah, thank you, Didit. And we go to the second question from Raja Laksmi Ramprakash to Bu Yuni. The question is how they are working with companies to make them aware of the links between increased target pressure and women workers' physical and mental health. And I have one question again for Bu Yuni. Do workers use the lactation rooms or lactating rooms? Thank you, Bu Yuni.
ಯೂನಿಯರ್ಗೆ ಪ್ರಶ್ನೆ ಇದೆ, ಕಂಪನಿಯಲ್ಲಿ ಯಾವ ರೀತಿ ಮಹಿಳೆಯರ ಆರೋಗ್ಯಕ್ಕೆ ಏನೆಲ್ಲ ಕ್ರಮಗಳನ್ನ ತಗೋಬಹುದು ಅಂತ. ಹಾಗೆ
Okay, I will start to answer the question about the lactating room. Actually, yes, all the female workers can easily access this facility to give the exclusive breast milk for this baby within 6 months for the exclusive. And then in Indonesia, we have specific procedure and policy related with this facility. So all the company, if they refer to the local law, they need to provide this facility. Yeah. Thank you.
Bu Yuni, I'm sorry, I have one question again for you. From Raja Laksmi Raprankash, how they are working with companies to them aware of the links between increased target pressure and women workers' physical and mental health. Maybe you can please to answer.
Yeah, actually we have a specific policy and procedure for the ensure that all female workers especially measure the health status, including for the physical and mental health. So we provide the counseling room and provide the psychology to raise up if any some issue related with the mental or physical health. Yeah, we have the procedure, so we all the worker, both for the leader and the worker, can follow the procedure.
Okay, thank you very much. I think that's questions, Lisa. Back to you.
Yes.
Thank you.
Thank you very much, Kiki. And I'm very sorry to everyone whose answer hasn't been replied to. We have very little time. That's why we have to stop here. But as you can also see, this is a big topic and we have a lot more information on this. So if you have any other question that is still left, or if you want to get into the contact with us, please don't hesitate to contact any of us. And I think our email addresses were also shared in the chat. And there's also some more informational material in the chat. We have a very short poll for monitoring purposes that we would start now. Would be great if you could still answer that quickly. It's just 3 questions. So you have to scroll down to answer to the 3 questions. Would be great if you could still do that. We will leave it open for a moment. And while the poll is running, I would like to thank you all for listening to the different voices and experiences on the topic of gender responsive health and safety systems. Like I said, those were some examples that we gave you today. There is a lot more to tell and a lot more to do, and we are up for it. Yeah. I mean, you can see there are already some success stories, and we have heard some plans for the future and challenges in the implementation of specific measures. And so please don't hesitate to contact us in case you have more questions. I would also very much like to use the chance to thank all speakers of today. for your time and for your inputs. It was very insightful. And I would also very much like to thank the interpreters, Esther and Preeti, who have made this event accessible to people who speak other languages, and also to Marie for her technical support, and of course to the rest of the MAP team, the project team, which has been working tirelessly to make this project and also this session a success. So thank you all very much. I hope you have a great time with the other OECD sessions. And we wish you a very great start of the week and rest of the day. Thank you so much. I can see that many people have answered already to the questions, at least to the first two. Yeah, I mean, you have to scroll down to answer to the other questions. We will leave this open for 2 more minutes. Before we will all say goodbye.
Then let me get this chance to say thank you, Lisa, for the moderation.
Okay, I think we can end the survey and also stop the recording.